Decriminalization has been a hot topic this week. We've heard a clear message that local governments support decriminalization, as you mentioned in your speech, but there needs to be more support available for substance users, including safe consumption sites and treatment on demand. Do you share the view that there aren't enough supports in place? And if so, what is your government's plan to address this?
Well, I can tell you unequivocally that one of our biggest challenges around this is not a lack of willingness or even funding. We have $1 billion in the budget around mental health and addiction treatment. Our biggest challenge is the personnel to be able to deliver the programs that we want to be able to deliver. The psychiatric nurses, the psychiatrists, the addiction doctors, these are big challenges for us to be able to deliver programming. So we're going at this from a couple different levels. The first is we have a health human resources strategy around training places in schools, about opportunities for people to take on these really interesting careers, critically needed careers. That's longer term. Shorter term, around internationally credentialed doctors and nurses, getting them through the system faster. So for nurses, paying for their assessments, paying for any courses they may need to close the gap so they're able to get to work right away. And for doctors, return of service agreements, fast-tracking doctors so they can support underserved areas. And beyond that, we're looking at is there a way for us to provide certifications for people that would work under the supervisions of these professionals? Do we need a registered psychiatric nurse in every situation? Do we need an addictions doctor in every situation? Could we use social workers more effectively? Could there be a certificate program where people are able to work sort of like analogous to an LPN or a care aide to a registered nurse, so we can get more people deployed faster to deliver this care? And I want to thank there were a number of local governments who came forward with specific either sites or organizations that are interested in delivering treatment, addiction support services, mental health services in your community. That is invaluable to us because we're looking to expand as quickly as we can. And the Canadian Mental Health Association right now has a call out for funding for programs like that as well. We're happy to work with you and keen to work with you on delivering more of those services. Absolutely.